MLT Case Study Series 14. Cherry Red Spot in 18 months old, a case study for medical lab technologists. A journey from clinical observation to genetic diagnosis in pediatric care. Introduction to cherry red spot. A cherry red spot is a retinal finding that is characterized by a red appearance on the macula. It occurs due to the loss of transparency in the surrounding retina, which is caused by the accumulation of abnormal materials. The central fovea appears red because it is less affected, thus creating a stark contrast. This condition is associated with several inherited metabolic disorders, most notably Tay-Sachs disease, as well as other conditions like sialidosis, and can be a critical indicator for diagnosing these conditions in young children. Objective. The objective of this case study is to enhance the understanding and diagnostic skills of medical laboratory technologists regarding the identification and implications of a cherry red spot, particularly in pediatric cases. Case presentation. An 18-month-old child was brought to a pediatric clinic by concerned parents due to the child's delayed milestones and a noticeable lack of response to visual stimuli. The child had normal birth and development history up until the age of 1. Family history was unremarkable. On examination, the child appeared to have normal outer eye structures, but exhibited signs of startle response to sound and not to visual cues. Diagnostic approach. Given the symptoms, an ophthalmologic examination was conducted, revealing a cherry red spot on the macula of both eyes. This finding prompted further biochemical and genetic testing to explore the underlying cause. Laboratory tests and results. Hexosaminidase A activity test. This enzyme activity is significantly reduced in Tay-Sachs disease. The child's levels were found to be substantially below the normal range. Genetic testing, specifically looking for mutations in the hexa gene, which confirmed the diagnosis of Tay-Sachs disease. Discussion. Tay-Sachs disease is a fatal genetic disorder that causes progressive destruction of the nervous system. It is most commonly found in children, with a cherry red spot being a hallmark sign. This condition is autosomal recessive, meaning that the child inherits 2 copies of the mutated gene, one from each parent. The hexosaminidase A enzyme is crucial for breaking down gangliosides in the brain and nerve cells. Without this enzyme, gangliosides accumulate, leading to the symptoms and signs observed in Tay-Sachs, including the characteristic cherry red spot. Importance for medical lab technologists. For medical lab technologists, understanding the pathophysiology behind the cherry red spot and its association with metabolic disorders is crucial. It highlights the importance of comprehensive diagnostic approaches, including both visual diagnostic techniques and biochemical/genetic testing. Technologists play a vital role in the diagnostic process, from preparing and analyzing samples to interpreting and reporting results. This case study underscores the importance of integrating clinical observations with laboratory findings to arrive at a correct diagnosis. Conclusion. The identification of a cherry red spot in an 18-month-old child led to the diagnosis of Tay-Sachs disease, a severe genetic disorder. This case study exemplifies the critical role of medical laboratory technologists in the diagnostic process, emphasizing the need for a thorough understanding of the implications of laboratory findings and their correlation with clinical signs. Early diagnosis is vital for managing symptoms and providing supportive care, highlighting the essential contributions of laboratory sciences to pediatric healthcare.